I'm Wendy Duggleby, and I'm a professor and a research chair in Aging and Quality of Life and director of the Innovations in Seniors Care Research Unit at the Faculty of Nursing, University of Alberta. The first thing we found is that they actually undergo significant changes in their roles and relationships. So the relationships changed very much with their wives when they're going through cancer treatment and afterwards as well. So that really changed. Their lives changed significantly, because even if their wives were considered cancer survivors, even after that, there was always that worry, right, that cancer would reoccur. And cancer, of course, has been considered a life-limiting illness. So what do we do now? Like, our goals and our hopes change, right? What should we plan for now? How far in the future? Like, so many questions. And they said the biggest, hardest thing for them, and what they really needed help with, is they didn't know how to even talk to their wives about it. They didn't know what to do, if they should even offer to help. We went through a series of steps to determine what should be part of this intervention. What would be the key things to include that we could help the male spouses with? And we used the idea of a web-based intervention because then it was convenient. They can use it on their smartphones. It's flexible. And in other words, what happens is the men can choose what they want to do, when they want to do it. So it's got a lot of options for them, as well as resources that they can access. In developing it, we also had several male spouses who helped us develop it. And for example, they said what we really needed was a glossary. So they started to look up words and put together a glossary that could be helpful. The other thing they said was, there's so much on the internet, but we want to know the best sites. Can you, at least in the resources section, include what would be the best sites to get the best information? So we did that. So it's called Male Spouse Toolkit, and we shortened that to MAT. They can jot down things they might think about. They can upload pictures, they can upload music, just whatever it is they want that might give them hope each day. And then they're encouraged to revisit it each day. So there's several pieces like that along the way. There's things like, what is my goal? There's, how can I help my wife? We developed a tip for communicating with your wife. It's a bit of a guide. And we asked them to try different strategies, see what works for them and their wife. But in order to do that, we then went back to the literature, looked at what was most effective. So within the About Me section, all the activities that they can do are all evidence-based. They would say, this was really for me, because everything's focused typically on their wives. And they found very often they get excluded from that care and that experience, sometimes because they can't get there to be at appointments, but very often as healthcare providers we exclude the family member. And so there was actually quite a lot of positive comments. And they didn't realize how much they needed help. One of the hardest things in the study was to say, no, this is really for you. And the men would say, no, I'm fine. I need something for my wife, right? And they came to this realization with doing some of these activities that actually they really did need some support. And because they got that help, they were able to then be with their wife more, right? Have a better understanding of what they're going through, and they talked about their partnership getting stronger, which wasn't something we expected at all. When you're thinking about supporting and working with caregivers of people with cancer, the first one is, and we found this over and over again in our studies with the male spouses with breast cancer, is they are not focused on themselves, right? And so to take a moment and to ask them, gain their trust, and not just to take the answer, everything's fine, you know, just look after my wife, we're here, right? So it's to remember that cancer doesn't just affect the person with cancer. You know, we know that, but I think sometimes in busy practices we forget. That's so, so important. Because even in our previous work, you know, the women with breast cancer were worried about their partners. So, and the quality of life of the women with breast cancer is significantly related to the quality of life of their partners. So no matter how much research we do, it's just such a really important part. The other thing is to gauge whether that partner would like to be more involved. But the best thing to do is openly invite them to be more involved so that they're there when the discussions are going on. And to give them some resources. Now, the beauty of a web-based intervention is you don't have to say anything. You can just say, here, why don't you take a look at this link? See, you know, when you want, take a look at this. There might be some things that might be of interest to you, right? So you're not sort of forcing it on them, but then they can, when it's convenient to them, they can take a look and see what might help them. So that's an important piece too. But I would say, without a doubt, we have to be very careful. Just like the men said, tell us which websites are the best. We need to do the same. So I would say to all providers that take a look at these resources. Look at who's developed them. Look to see if they've been evaluated even. Because they just come up on the web and there are all these things and nobody's really evaluated. And I think that evaluation is a really key thing before we consider and say, here, you know, take this and use that. So really the key messages are, we know this, family care is so important. Take a moment and make sure that you're also including them in the care, including them in what's happening with their partner and not excluding them. And then, but if you do notice their distress, I mean, the web-based interventions are self-administered, but if someone's in clear distress, you have to get them a real person